All right, guys, give me a moment. Okay, here we go. So, my experiment took comparing visual analysis and video modeling on the frequency of correct table washing steps as measured by task analysis in a teenager with autism who is in a school-based vocational program. So, this research aims to identify whether a visual analysis or video modeling is more effective in improving table washing skills in a teenager with autism. And this is specifically within a school-based vocational program. And this is the school that I am employed at, which is called Strawbridge School. Um, so the goal of this skill is to enhance task performance, foster greater independence, and job readiness. So the research question that I took for this experiment is, what is the effect of visual analysis versus video modeling on the frequency of correct steps completed in table washing? The participant that I took was a student of mine. I'm going to use a pseudonym for this, and it's 15-year-old Nicole Wells, who has autism spectrum disorder. The location takes place in a multi-purpose room in a private school, and this is the school that I'm employed at currently, which is Strawbridge School. Uh, for social validity, I feel like the skill is important for job readiness, increased independence, and greater responsibility. We all know that a lot of entry level positions require basic skills like this, such as washing tables. Additionally, standard hygiene practices involve washing tables. For my research findings, I based this on polling and um, all the all these research. Starting with polling, he basically did something similar to mine, where he took video video modeling on the accuracy um, of steps completed in a task analysis. And in this research, he found that 79% um, performed each step of the task analysis during the video modeling intervention phase. And we're actually able to maintain these skills with 90% accuracy, which is awesome. Taking all these experiment and colleagues, she did video modeling on activities of daily living. And basically, her research showed that both participants showed a significant improvement on their daily living skills with video modeling. And this also was marked by increased accuracy during the intervention phases and sustained high performance levels over time. Moving on to methods, I use the alternating treatments design. And this design basically uh, alternates two different interventions um, or treatments across sessions to compare their effects on a specific behavior. And this can be within the same individual. So this allows for direct comparison, and it decreases the chance of extraneous variables by allowing that control over individual differences by doing it within the same individual. So for independent variable, I had two, and the first was visual analysis, the second was video modeling. For the dependent variable, it was the frequency of table washing steps completed. For data collection, I used a task analysis, and I basically uh, outlined the steps of table washing. Um, I put, I basically did it by the three conditions, and um, I basically put a plus if they got the step correct, which is without prompting, and incorrect if they needed prompting. Um, and at the end, I did a frequency count of total correct steps um, for each one. So for the target behavior, It is the correct completion of table washing steps, and for the prompt expectancy, you expect it to prompt when there is no task initiation or incorrect task initiation. So going through the procedures, starting with condition one, this is baseline. So there are no visual aids. For preparation, you have to gather the materials, which is the soapy water and the bucket, and the rag, and going to the multipurpose room. Tasks, you have to provide the student with gloves and tell them to wash the table. And for data, you would record correct steps as a plus, incorrect as minus. Prompting least to most hierarchy if needed, and that is if the task is not initiated or not done independently. Or done incorrectly. For scoring, it would be the total correct steps and 3 trials for this condition. Moving on to the condition two, which is intervention one, visual analysis. You would use pictorial steps. For preparation, same as baseline, gather the materials, going to the room. Visual analysis, you would place the pictorial steps on the table, give the student some time to examine it. And for the task, it would be same as baseline. So you would give the student some gloves and tell them to wash the table. For data, you would record correct responses as plus, incorrect as minus. Prompting least to most. Scoring is the total correct steps, and 3 trials again for this condition. Now we're moving on to condition three, which is intervention two, and that's video modeling. So for this condition, you would use video demonstration. For preparation, it would be same as baseline, which is getting materials, going to the room. For the video, you would play the video of task steps. For the tasks, it would be same as baseline. Give the learners some gloves and tell them to wash the table. For data recording, plus is correct, minus is incorrect. Prompting, you will use least to most hierarchy, and scoring, it would be total correct steps. There are 3 trials in this condition. For the results, Nicole had the lowest frequency of correct table washing responses at baseline. And although visual analysis improved the frequency of correct steps, the highest frequency was achieved with video modeling. And specifically, the step that had the highest skill acquisition um, using video modeling compared to both baseline and visual analysis was checking for visible streaks and spots. Over to the far right, you can see my graph, and basically I have the days or the sessions for my x-axis, and for the y, I have the frequency of correct steps. So you can see baseline was the lowest, then visual analysis, and then video modeling. For my discussion, I basically went over the study and basically what it assessed, and that was the effectiveness of visual analysis versus video modeling when improving table washing skills. And basically, the results revealed that while visual analysis enhanced performance, video modeling resulted in the highest frequency of correct steps. And basically, that the step involving checking for visual streaks and spots showed the greatest improvement with video modeling in comparison to both baseline and visual analysis. So for the findings, I think that these results indicate that video modeling is a more effective method for teaching detailed tasks, because I think the video modeling is really great at targeting that precision. Not only just getting the steps correct, but the precision along with that. And this, again, it would be for skills that require attention to detail. And So the significant improvement in skill acquisition indicated that video modeling is a valuable tool for task performance in individuals with ASD. And I think this finding can inform educators and practitioners to consider video modeling as a primary intervention for vocational skills training, and not just that, but instructional training as well. Um, I think the video modeling can be used during lectures for different ways of transitioning and things like that. I think um, being that this is such an effective method um, for enhancing the the accuracy and frequency of correct steps. I think that it should be utilized in as many ways as possible. So the limitations of this experiment was the sample size, um, and this may not be able to translate to a broader population. Also, well, because I took one person, and then also the study was conducted in a controlled setting, which might not fully be representative of a real life condition. And future studies could benefit from a larger sample size and diverse settings to basically get a broader picture of those findings. Um, and I think more follow up assessments and research can help provide more of a comprehensive understanding in the effectiveness of video modeling. So that is all for mine. Um, as far as the references, I have them listed at the bottom here, and that is it. Thank you guys for watching, and good luck.